mental health in South Africa in particular. So they did a consensus study in 2020, and they found out that 1 in 6 people will suffer from a mental health condition in South Africa at any given time, which is a very high amount. And unfortunately, only 25% of these people will receive treatment. And when we refer back to children, we think about what types of mental health conditions exist in children. And ADHD is one of the most common childhood disorders. It affects 5% of the population. Anxiety is around 8 to 11% of the population. Unfortunately, in your low income and middle income countries, there's mental health problems affect around 10 to 20% of children and adolescents. And a study done within the Western Cape suggests that 17% of children in the province have a diagnosable mental health condition. So you can see that mental health in South Africa is quite a problem, and especially with children accessing the mental health care. And unfortunately, children bear the brunt of a lot of not being able to access treatments. And although there are mental health clinics in the public sector, children with ADHD or other mental health conditions often never reach a point of diagnosis in treatment, basically because there's not enough information. When they go to a clinic, they have to go back and forth, and it's very difficult for parents to take children to clinics to get them the help that they need. There's transport difficulties. They have to take the day off work to take their child there. There's difficulties with transport. So there are a lot of factors that we have to take into consideration of getting these children the help that they need. This is where we come in as a foundation. So we are a non-profit organization based within the Western Cape, mainly in Cape Town. We provide free mental health screening and early intervention services for underprivileged communities to help identify children with mental health disorders such as ADHD and other learning health difficulties. Our vision in the foundation is to build resilience and resourceful children free from mental health difficulties. And our mission is to try and improve child well-being through supporting evidence-based integrated mental health services. So that is bringing all professionals on board to help with the treatment, identification, and management of mental health difficulties. We do a few services within the organization. So basically there are 4 areas of services that we provide. The one is raising awareness and advocacy. So we want to raise more awareness about mental health to break the stigma. So we provide information to parents, to teachers. We use the media platforms. We use social media. Our social media expert is here next to me. She provides amazing content to share awareness and knowledge about mental health, ADHD, all of those types of things. We also use sporting events to help raise awareness as well as to raise funds for our organization. We also do workshops, ADHD workshops for teachers and parents to identify and help treat the ADHD and manage the ADHD at home and at school. We do training for healthcare professionals. We also do training for departments such as Department of Health, Education, Social Development, and other NPOs, and webinars like this that we're doing today. We also do screening and referrals. So this is where we actually sit down with the child, spend one-on-one time with the child to try to figure out what is happening. So we get information from parents, from schools, and we sit with the child and we try to pick out where's the child experiencing difficulties. This information then goes to a qualified healthcare professional who determines, okay, maybe this child does have ADHD, or and we refer directly to the clinic. But if we think maybe there's more depression, anxiety, maybe we refer to psychiatry. Perhaps we figure out maybe there's hearing difficulties, so we refer to audiology. Visual difficulties, we'll refer to optometry. So we try and work with the child in a multidisciplinary way to try and identify where the child is struggling the most. So we have an amazing volunteer network that helps us to manage and assess these children. We also do a lot of data collection. So we collect statistics regarding the prevalence of ADHD and other mental health, as well as learning barriers. this will hopefully help us to work in policy changes, and one day hopefully we can gather enough data to say we know these children need a lot more help than what they're getting. This will also be for academic research, so we know what's really happening within the communities we serve. Michelle told me the other day that she was trying to look for research on anxiety and depression in this age group and the population that we serve, and there isn't much. So we really have quite a bit of work to do.
So, South Africa is committed to the United Nations Sustainable Development Goal number 4, and this is to ensure inclusive and equitable quality education and to promote lifelong learning opportunities for all people. So the education system plays a great role in building on an inclusive society and providing equal opportunities and helping all South Africans to realize their full potential. So Claire, I don't know if you want to add.
So this is basically trying to include children that struggle or that have different or unique learning abilities. So this is why, there's a whole new system trying to be implemented in the schools. Some schools are a little bit more up to date, and I think more of your um, schools that don't have enough funding and limited resources, they have a lot more challenges with this. But in general, it's actually required by the Department of Education to help these children and include them in tasks by adapting to their needs and working at their level, because some children work at different levels, but they're in the same grade or they're doing the same task, and it's to give them a support and the platform in order to get them on equal footing with their peers. So this is what it's all about, is giving those equal opportunities for these children so that they can actually show their full capability of doing something. And I think a nice way of describing it is a child that can't see properly needs glasses and able to read the same as a person that doesn't need glasses. And it's about giving someone those glasses, whether it's extra time, whether it's extra support, whether it's individualized attention, but giving them the tools that they need so that they can read properly and succeed and reach their potential. So what we want to do is try ensure that all children have this access to quality education, so we meet those sustainable development goal that is supposed to be supporting our whole education system. And at the end of the day, to include everyone, to create that inclusivity.